Welcome back to America's Web Radio. This is Healthcare Insights, where we believe in creating the possible. We are beginning a series of podcasts that are available on www.americaswebradio.com, where we will be on every Thursday at 11 a.m. That's the schedule. It may change around, so you want to check on the website to see where we might be placed. But right now, we're scheduled to be on every Thursday at 11 a.m. We will also be available on other sources where you may currently be going to find podcasts like iTunes. America's Web Radio will also post YouTube videos of this program. So just go to YouTube and search for America's Web Radio. Following our tagline on creating the possible, for the next few weeks, we'll be exploring how to create a private, free market for health insurance. You know, it's easy for government bureaucrats and politicians to take over and regulate an industry, but it's much, much harder to take an industry that's already overly regulated with mandates, rules, and requirements and transform it into a free market that benefits consumers and patients. It may seem impossible to create a consumer-driven and patient-centric private health insurance market that offers affordable coverage, quality medical care, and voluntary universal access. But that is exactly what we're going to outline over the next several weeks, so stay tuned. Skeptical? I don't blame you, but I guarantee you it is possible. Much of what we will discuss was developed in the 2008 and 2009 period by me with members of Congress and other healthcare experts. But these ideas were aborted when Obamacare passed in early 2010. While these ideas have been dormant for the last decade, they are still valid and may be the real solution to the repeal and replace of Obamacare. Free market advocates must be prepared for the possibility that the current court challenge to Obamacare may invalidate the entire Affordable Care Act. It is also possible that the next election in 2020 will see enough votes in the U.S. House and Senate to once again tackle repeal and replace of Obamacare. Even if none of this happens and Obamacare stands, there is a safety valve within Obamacare that allows states to develop reforms that give them flexibility from much of the Obamacare requirements. It's referred to as a state innovation waiver under Section 1332 of the ACA. With a favorable administration and power and a flexible health and services department, much of what we will explore today can be implemented now, and there are several states looking at how to do exactly what we're going to describe, and we hope that many people in these other states, politicians, regulators, governors, lieutenant governors, will listen to these podcasts, will read the materials that I'll share with you, will go to the websites that are available that will outline exactly how we can avoid much of Obamacare and implement a repeal and replace if Obamacare is in fact ruled unconstitutional or is voted out after the next election. So here we go. Let's set the foundation for health reform. Health reform proposals are generally very confusing. To clarify this difficult topic, let's follow the KISS principle. That is, keep it simple, stupid. Too much in healthcare sounds too complicated, especially to the general consumer or patient, let alone to politicians who have to deal with so many other topics. They don't have a really good understanding of health insurance or health care. Concerning healthcare, everyone tends to point the finger of blame at someone else for our current dysfunctional healthcare system. Insurers blame hospitals and doctors. Hospitals blame insurers. Doctors blame lawyers. Employers blame non-compliant employees. Hospitals blame technology. And so the blame game goes on and on and on with no solution. Consumers and patients are caught in the middle, simply wanting to get care and treatment they want, when they want it at affordable prices. Well, as we all know, healthcare represents a very large part of our gross domestic product. In 2017, it represented 17.9% of our GDP. Any industry that large is complicated, has lots of vested interests, and is difficult to reform. Most politicians and pundits talk about comprehensive healthcare reforms that are needlessly complex because they include other political agendas. Of course, nearly all areas of healthcare need some reform. Medicaid, insurance for the poor, is too expensive and fraught with fraud. Payments to care providers are so low that many doctors do not accept Medicaid patients. So you may have Medicaid coverage, you've got a card, but you really can't get Medicaid care because the doctors don't accept it, or you're put at the back of the line when you need care. You wind up going to the emergency room. Medicare, insurance for age 65 and older generally, is running out of money. Baby boomers are overwhelming the Medicare system. The Veterans Administration, the VA Health, has long waits and inadequate care. And on it goes, problem after problem after problem. We've all been involved in the system at one point or another for ourselves or family members or friends, and we can see the problems when we get involved with it. We say, why can't this be fixed? Why can't that be fixed? Well, remember the old joke, how do you eat an elephant? The answer, one bite at a time. How do you solve massive problems? Start with an area most in need, where change can have the biggest beneficial impact. This is especially true when the problems of healthcare have massive political implications. So let's simplify health reform by prioritizing needs and using the process of elimination. First, let's separate health insurance from health care. While they are intertwined, health care is how one receives services from medical providers, that is, doctors and hospitals, and other affiliated service providers, medical providers. Health insurance is how one finances those medical services. 176 million Americans access health care through their private employer-sponsored health insurance. Most voters are concerned about 1, the cost of their health insurance, 2, coverage of pre-existing conditions, and 3, their out-of-pocket costs for deductibles and co-insurance. The program we're going to try to discuss and develop in these podcasts and videos focuses on fixing the private health insurance system for about 200 million Americans. Second, let's recognize that Medicare and Medicaid legitimately need reforms as they are government health insurance programs critical to federal and state budgets. Those issues should be addressed separately. There's an enormous amount of waste, fraud, and abuse in both of these programs. In fact, the Medicaid program is probably the fastest growing area of organized crime, and it's been on the Government Accounting Office, which is a watchdog organization. It's been on their fraud list since the late 70s. Government-controlled programs, by their very nature, are politically sensitive. Solutions are difficult, with significant lobbying interest and resistance from special interest constituents. Let's set aside these programs for separate actions. Third, other government programs, the VA health system, TRICARE, the Children's Health Insurance Program, and others, all need reform and added flexibilities to improve coverage and patient care. Again, the programs we're going to discuss suggest that these issues be dealt with separately through appropriate legislative and administrative actions. I can lay out my thoughts as to the solutions for all of these, but again, we have to focus on the biggest piece. And so what do we have left? That leaves the focus on health insurance needs of 3 major populations of about 200 million people. The first one, employer-sponsored health plan groups. 2, individually purchased health insurance. And 3, the uninsured population. Let's take a look at each of these groups. The first one can be split into 2 pieces: large employers and small employers that offer employer-sponsored and employer-subsidized group health plans. The first one, large employer-sponsored plans, provide affordable employer-subsidized premiums for about 120 million persons. That's employees and their dependents. Large employers provide, on average, 82% premium subsidy to single employee coverage. So if you're a single employee, you don't have any spouses, you don't have any children, you just want to cover yourself, the average subsidy for your health insurance by the employer is 82% of the actual cost of that coverage for the single employee. And if you got a family, whether it's just a spouse, whether it's children, the average is that the employer will subsidize 74% for that family coverage. Large employer-sponsored health plans avoid many of the Obamacare mandates by using something called self-insurance. Self-insurance is an exemption under Obamacare from many of the mandates, but they still need regulatory relief from some of the remaining aspects of Obamacare. Things like mandated coverage, definition of full-time employee, and something that's really troubled them for many years that keeps getting delayed called the Cadillac tax. That if your benefits are too rich, you can pay up to a 40% tax on that excess coverage that you want your employees to have, their dependents to stay healthy and to provide them the benefits that they need. But Obamacare says, no, you can't provide that rich of a plan. Well, many union plans, as an example, and many large employers have fairly rich plans that they heavily subsidize for the benefit of their employees. But Obamacare says, no, you can't offer those kinds of good plans. You have to offer the same size fits all, kind of a one size fits all plan that is not as rich as what many employers would like to do to maintain their human capital. What is a self-insured plan anyway? Well, a self-insured group health plan is one in which the employer assumes a financial risk for providing health care benefits to its employees. Basically, they pay an insurance company, which doesn't act as a real insurance company. They act as an administrator. They process claims, do actuarial work, do legal work, do all sorts of enrollment, education, provide the services, go out and do network discounts with the providers. But at the end of the day, the insurance company is not really acting as an insurer that pools the risk. The risk of claims is with the employer. There's also companies that are not insurance companies at all that are called third-party administrators. They're simply administrators that provide those same services for an employer, and many employers find using a TPA that's not an insurance company to their benefit. In any case, whichever approach you take for who's going to administer your plan, the employer goes on a self-insured route instead of a fully insured. So let's stop here and take a break. We'll be back in just a minute. Let's talk about the second part of the employer package, and then we'll go on and talk about the individuals and even the uninsured that still exist under Obamacare. There are 28.5 million of those. These are all the people that really need our help and care, understanding these concepts we're going to be talking about.